All right, I'm going to call this meeting to order. All right. We will start with the consent agenda, or I guess next will be the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on March 23rd, 2015. Minutes of the monthly trustee meeting on March 24th, 2015. And a check report March 8th, 2015 through April 7th, 2015. I would entertain a motion.
Mr. Chairman, I move that we approve the consent agenda as presented.
I'll second that.
We had a motion by Darlene Sanderson, a second by Dr. Kinsey to approve the consent agenda as it was presented. Roll call vote, please.
Klein?
Yes.
Gaspard?
Yes.
Hanford?
Yes.
Kinsey?
Yeah.
Yes.
Knox?
Yes.
Sanderson?
Yes.
Simon?
Yes.
All right, I had one thing that I kind of forgot, and I don't know how I could forget it. But joining us,
That was awkward.
joining us on our board, sorry, Bo, is Bo Hannaford. He takes Scott Brown's position as our city council representative. So welcome to Bo.
Thank you.
And thank you for being willing to serve. And I'm sorry that I forgot to do that at the very beginning.
I didn't think about it at all, trust me.
I did, so, sorry. Okay. Next item is the CEO's report. Candace?
Well, not a lot to report for this last month. I am very happy to say that Northwest PT, Aaron White's company, has hired Shannon Rose, which is a hometown girl that grew up here, and she is getting ready to graduate from physical therapy school. And so she will be taking her test sometime soon and joining Aaron's crew this summer and be back here in Alva. So we're really looking forward to seeing Shannon here before long. Upfront collections for the month of March were $37,442. So great job, registration staff on upfront collections. We appreciate their efforts. You can go through there if you have any questions regarding anything in my report. I did present to Kiwanis. I took our nurse practitioners, the new ones from urgent care and the physician's clinic, and I thought they did a great job kind of telling them about themselves and what they do. So we always like to get out and promote those things that we do here. Sometimes people aren't ready to hear or see our ads, and when we can get face to face with them, we get lots of great questions and feedback. So if you have any groups that you would like any of us to speak at, please let us know. We enjoy doing that.
You guys haven't been to Rotary yet, have you?
Not in a while. What are you laughing about?
No, in a while.
In a while.
Yeah.
Yeah, we've been there.
Like you're there
Sure.
all the time.
Yeah.
Not that rude necessarily.
Yeah.
We'll get you there.
Really, that's all I had. Anything more on that?
I think just to, down there in Candace's, under miscellaneous, Candace had contacted the Enid urologist. I think just to clarify some things that had been out there with urology. One is we did have to come up with a plan to move them based on our survey, and we had rented some space from the city to place them. And at this point, they have not signed any formal contract, and so with us. So just for the public, I guess, wanted to know that we have made efforts to make that happen. And my guess is one way or the other they will be here, but when they will come back, I'm not sure.
Do
I do have a question. We talked about at the last meeting about signing up for the patient portal. Are we doing any better on that than we were before?
Last time I knew, we were just right
Right,
there.
it was real close, it was almost
Okay.
at 5%, we're not quite there, but we was almost right there where we need to be.
I was just curious how it's going.
It's a tough sell.
Yeah, I bet it is. It is tough.
Are we at-
Over
Okay.
5% now, good.
And that meets the
The
meeting.
threshold.
Yeah,
For this year.
okay.
For this year.
That's what counts, yeah.
Got step one.
Yeah.
Okay.
Oh, it's like 25% next year.
Yeah.
Wow,
It
it's
just
way up.
keeps
going
Okay.
way up.
50%.
50% next year? Yeah.
Wow.
What can we do, and this is for inpatient though, right?
Inpatient and ER.
And ER.
You come to the ER or you can be an inpatient, we'd love to have you.
Okay. Hopefully.
He's thinking no.
That's on a need-to basis. What can we do to, is there anything that we can do?
You have to be a patient encounter in either the ER or an inpatient for that sign up for the portal to be included in the numbers that we need for that 5%.
I'm guessing we can't give them a discount on their bill if they sign up. I mean, it wouldn't have to be large.
I don't know, Bridget?
Good, or like a gift certificate or
Yeah.
something. I mean, you
Yeah,
certainly could.
chamber bucks.
There's nothing that says you can't do that.
Yeah.
There's no inducement to that or anything, it's just,
Hey, if they
yeah.
gets
If
us.
they sign up,
Yeah,
yeah.
it keeps us from going the other way. Holy
Okay.
cow.
Food for thought.
Yeah.
Any other questions for Candace? If not, I would entertain a motion.
Mr. Chairman, I move we accept the CEO's report as presented.
Second.
We have a motion by Steve Knotts, second by Bo Hannaford, to accept the Share Medical Center written report for April 21st, 2015. Roll call vote, please.
Klein?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Knox?
Yes.
Sanderson?
Yes.
Klein? Yes.
Just in case you missed it out of your packet, we're going to try to attempt to not kill as many trees. So we've got, 2 or 3 copies of the HCAHPS scores from the patient satisfaction surveys. These drive, I don't know if any of you have seen it, but the Medicare 5-star hospital compare that they do now. You can find that on the internet. These are what drives that score. So just so you know, you can look here to kind of see how we're doing on those things. That kind of gives us a gauge of patient satisfaction. Okay.
All right. Thank you. Kevin, next is CFO's report.
Sure. During the month of March, we had total revenue of $1,750,363. That was a $111,600 decrease compared to prior months. All 3 entities seen decreases in their revenue. The hospital's revenue decreased by $67,069, the nursing home by $38,157, and the homestead by $6,390. Large part of the decrease was due to the less patient days. We had 93 days in March compared to 144 in February. Hospice days were 140 in March compared to 102 in February. Clinic visits were actually down for the first time, but we knew with the flu season going, the urgent care to be down. We went from 1,647 in February down to 1,558. So we're still busy, but that's not quite as busy as we once was. Nursing home averaged 48.3 patients in March compared to 52 patients in February. For the month, our contractuals were up to 55.9%. This was due to the fact that we had some RAC issues that we had to pay back. It was almost $58,000 there, so we took care of that, and we had to pay the cash back, but that also makes a contractual allowance there. We wrote off $85,251 to collection agencies. Our salaries and wages was up to $417,692 compared to the prior month. Operating expenses, $417,692 compared to the prior month. And salaries and wages is up to $494,741. We had a net operating loss for March of $263,096, And even after sales tax, we had a net loss of $171,330. We continued to have a good cash position from March. We had $556,202, which was 15.9 days of operating expense. And our accounts receivable continued to decrease. For March, we were down to $2,793,961, which is 57 days gross, 48.3 days net. Accounts payable also continued to decrease. We continued to owe vendors $622,278. We're down to 41.1 days on average to pay a vendor. So those were positives there. We flip over to page 2. That's just the income statement for you to look at. You can see, like I said, $1,750,000 in gross revenue. We had the extra additional money for contractuals, so we ended up with $907,424. But like I said, $58,000 of that was due to a RAC audit. You can see the other expenses. We lost $263,96, and even with sales tax, $171,330. Sales tax for March was down about $26,000 too, which is down. But we was talking about that. That was actually for February, which actually has a little bit fewer days. We just need to see if that's what the trend's going to be, or if that was just because of the fewer days there. So anyway, that's the sales tax. Page 3 is the other expenses. Really nothing there. Just gives you a breakdown of what's there. Page 4 is your year-to-date numbers for the combined entities. You can see we're up $2.2 million year-to-date for the first 9 months of the year. In gross charges, up almost $1 million in net charges. The other operating expenses, like I said in prior months, the reason that's down about $900,000 is to deal with in the prior year we got $1.4 million in EMR money. This year we got $700,000. So there's where most of that is, as well as last year we had the dissolution of the Cimarron insurance, which was another $200,000. So that's the reason you see the other operating revenue down from where it was last year. Net operating income year to date, a negative $937,036, but with sales tax and everything else, we're at net profit for the year of $199,418. Page 5 is just the hospital's income statement by itself. Like I said, you can see that patient days, reason that we see about a $40,000 decrease, we have a decrease in patient days, is where you see it there. Page 6 is the 2 years side by side. You can see that the hospital's net revenue compared to the 2 years, we're at $5,188,000 this year compared to $4,259,000. So we're up net position for at least the opportunity for cash of $900,000 for the 9 months there. So page 7 is the nursing home, $243,000 in gross charges. So ended up losing $5,417 from operations, and after some other contributions for the city, they actually lost $4,392 for the month. Year to date on the nursing home, the difference between the 2 years is mainly due to some accounting issues. I know this year we were really good about actually costing the nursing home what they're actually using for expenses like electricity and utilities and some other expenses that were at one time all combined into the hospital's income statement. So it gives you an idea and benefits and all that. So page 9 is the homestead. They're down about $8,000 in room rentals, and that's due to the fact that we had some residents that passed away, and that was the main thing there. But otherwise, everything else is doing real well there. And they actually made $9,203 for the month. Page 11 and 12 is your accounts receivable. Really not much change overall when you add back in the nursing home and into that. So page 13 and 14 is your balance sheet. And the last 4 pages is just the statistical graphs each month. Really not a lot of changes, just some volume decreases mainly in the inpatient side. So
Does anyone have any questions for Kevin?
Excuse good to see the accounts receivable over 150 days has gone down substantially in the last 6 months. That's really good to see.
Yeah.
I know we've written off a lot of that, but, I mean, it's something we need to get off the books, because that looks really bad when that number's so huge.
Right, and we're not, I mean, right now, everything that's going to collections, like 89,000 for the month, so that's not for, or 85,000, so we're not sending a lot of people to collections either, so people are making their payments from upfront collections, which makes a huge difference, as well as getting everything, you know, people to pay, get them set up on time plans quickly.
Any other questions, comments? If not, thank you, Kevin. Next, for the Medical Staff Executive Committee Report, Chief of Staff, Dr. Elizabeth Kinsey.
All right, we'll start with the agenda review. We actually included the minutes this time, so you guys can follow along if you so desire. First, we've had a long discussion for the last couple of months about the expansion of nurse practitioner privileges within the hospital. And nurse practitioners are allowed to admit patients to hospitals. Our bylaws at this hospital do not allow that, but some of the nurse practitioners that we have working here have said that they would like to be able to admit patients to the hospital. And so we've been discussing what that would include in terms of liability and expectations of patients and that sort of thing, if we were to have nurse practitioners admit patients to the hospital here, and what that could mean in terms of maybe lightening the load for the physicians who do admit the patients to the hospital too. Then there was the credentialing committee. I'll get back to that in a second because we're going to have to go over each of those. We talked about the contract reviews. As you guys might remember, we look at all of those one by one to kind of see, so we're not doing them all at the end of the year. There was, in order to keep patients from having deep venous thrombosis on the hospital floor, there are some protocols that can be followed, and the protocols are all a little bit different. We've been using an old protocol set that's on paper, and we're trying to transfer it to the electronic medical record. So we looked at some other sets to decide if there was another set that would look better on the computer and work out better. And so we chose to approve the University of Michigan DVT prophylaxis order set for use on the computer, and they're moving that over now. And then we also had a discussion about the medical staff bylaws, which have been updated, but we tabled that temporarily because there are some other requirements that need to be done before we can finally approve it. But each year that also needs to be approved, so it was just tabled for this year. We got the QAPI report from Pat, which she'll be giving to you. And that was pretty much the medical staff meeting, except for the credentialing committee. So
Okay.
I will talk specifically about the credentialing committee. The credentialing committee recommended that we reappoint to active staff Dr. James Culver, and I move that we reappoint to active staff James Culver, Jr., MD, Internal Medicine.
Second.
Okay, I heard Knox. Was that who?
Sure, he's closer to you.
Sorry.
Fine. See, no one's hearing.
It's the opposite over here.
You get the next one too.
We have a motion by Dr. Kinsey, a second by Steve Knox to reappoint to active staff James Colbert, Jr., MD, Internal Medicine. Roll call vote, please.
Klein?
Yes.
Gasper?
Yes.
Hannaford?
Yes.
Kinsey?
Yes.
Knox?
Yes.
Sanderson?
Yes.
Simon? Yes.
Next, we recommend that we reappoint to courtesy staff Dwayne Schmidt, cardiologist. He has maintained privileges here for many years and also is qualified for this position. So I move that we reappoint to courtesy staff Dwayne Schmidt, MD, cardiology.
Second.
We have a motion by Dr. Kinsey, a second by Terry Klein, to reappoint to courtesy staff Dwayne Schmidt, MD, Cardiology. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson,
Yes.
Simon. Yes.
I also move that we reappoint to courtesy staff John Chris Hummel, MD, Ophthalmology.
A second?
We have a motion by Dr. Kinsey and a second by Darlene Sanderson to reappoint to courtesy staff John Chris Hummel, MD. Yeah, what did you tell that? Oh, bad.
Ophthalmology.
Ophthalmology, sorry. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford.
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson,
Yes.
Simon. Yes.
Dr. John Ferris comes to us through the locum tenens agency. He's a family practice physician who has been covering he covered one weekend already in the emergency room, and we recommend that we appoint him to courtesy staff. So I move that we appoint John A. Ferris, MD, family practice to courtesy staff.
Second.
I didn't say that right. I move that we appoint to courtesy staff John A. Ferris, MD, family practice.
Did he kick you?
No,
That's what I was gonna say, when he got you under the table.
You still second that?
Wheels returned and I was watching.
No stress there, Bo. You have a card in front of you.
Paul, I like that.
Yeah. We have a motion by Dr. Kinsey, a second by Steve Knox to appoint to courtesy staff John A. Ferris, MD, family practice. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford.
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson,
Yes.
Simon. Yes.
And finally, I move that we appoint to allied health staff David Holland, an advanced practice nurse practitioner who's working in my clinic.
Second.
We have a motion by Dr. Kinsey, a second by Darlene Sanderson to appoint to allied health staff David Holland, APRN, nurse practitioner. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson,
Yes.
Simon. Yes.
That's all I had, Mr. Chairman.
Okay. Real quick question, back on the use of the nurse practitioners or the PAs, is that something you think that we'll be having something soon to bring to us? Or from your committee, or you don't know?
Maybe.
Maybe, okay,
I don't know.
okay,
I really don't. There's some discussion.
okay, all right, fair enough. Well, thank you, and thank you for all that you do. Next item is our coffee report.
I'm not gonna stand up this time, I always stand up, nobody else does, so I'm gonna stand up.
We do need to recognize that this is Pat's last coffee report.
Oh.
This'll be it, this is it, guys. I'm sorry, unless you meet me at another meeting somewhere. We had our meeting on April 7th and discussed some of the tasks that are being done for the QA. We did discuss that the portal enrollment is over 5%, so we were real glad to hear that we have been working hard to get the nurses have been working hard to get portal, every patient, whether they have an email or not, they get some family member to get in, so they've been working real hard on that. Mary and Amber have been working jointly with new employees, they're all tested and drug screened and lab work's being completed. New employee orientation takes place every 2 weeks, and their tasks are all 100%, so they're working hard with that. Physical therapy, wait times for physical therapy, they have rearranged their area now so that when the physical therapy patients come in, they don't have to sit in the front to register, they can go straight on back to physical therapy and register back there. And it has made a big difference. We'll be anxious to hear what Susan has in her task to measure that to see how well that's going. Credentialing, we did credential we did some credentialing in the quality meeting. Contract management, Janet's done a really good job of making sure that we have certain contracts that are reviewed at the quality meeting. And competencies, Janet states she's got about 4 competencies that vendors, she's been unsuccessful with. And you can only do so much of that. So if they aren't willing to give us their information, we might not be willing to use it. I don't know. Patient satisfaction surveys are going pretty well. One of the things that was expressed that there was a little bit of concern was the patients feel safe in their surroundings. It went from 5%, which is the very top, to 4.5 through. So we're going to do a little investigating on that. And that's really just about it. Harley's been working hard, making sure that everybody is working on their SQSS, and I think all departments now have a task that they're working on, and also a QI, which is a quality improvement. So that's what SQS is all about, SQSS, and it's working now. So we're real pleased to report that the system's on go. Any questions?
Is Harley ready?
Harley's ready. He's pretty sharp on the computer. I will say that I'm not very sharp on the computer, so he can kind of do all these little things, and I'm still trying to figure out what. So the truth is out. I'm no good at the computer.
That's
Pat,
not
would you
true.
introduce Harley?
Yes, I'd be glad to. This is Harley Wares. He's an LPN. He's worked in urgent care, and he's worked at the nursing home. And now he's going to be working in my position and doing the QAPI and CART and discharge planning. So I think he's ready to go. He's been here since, I think, the end of March. So I'm kind of tired of him. But anyway, I have another week, so we'll get some more things in, and he's doing a good job.
Very good. Thank you, Pat, and thank you again for all your years of service and the time, blood, sweat, and tears that you have poured in. And thank you. And we hope that you enjoy retirement. If you don't, come on back. We'll find a place for you.
I already have a new gator,
Okay?
so I will be checking fence and
Pat's gonna do the
I'm
chores.
gonna-
That's the new hired hand.
Free.
Free hired hand. I do believe that there is a retirement reception for you this coming next Monday afternoon, 4-ish?
2 to
2 to 4. I think.
2 to 4, okay? So
with cupcakes.
please plan on attending, or at least stopping by and saying hi and farewells. Thank you
Thank
again
you.
for your time and service.
Appreciate all you guys' good, hard work too. I mean, that's what makes this place go, is your time with us and helping us with problems, and I've appreciated it ever since I've been here, so thank you.
Thank
And a
you.
lot of you been here a long time too, so.
Not as long as you have.
Yeah.
Well, no. As Jody Evans would say, I'll never be as old as you are.
All right, thank you. Next, improvement to patient care, quality review of quality evaluation.
Isn't that the ACE?
That is the contract.
Oh, the contracts. Yeah. So you can see it's behind your improvement to patient care tab. Those are the contracts that multiple people review throughout the months as they come up. And we were doing it on an annual basis, and the surveyors preferred that we do it throughout the year. So once again, a reminder that we'll be bringing those here. And as you can see, these are the contracts. It has the vendor name of that contract that we reviewed and the service provided, and whether they were compliant or not. So we didn't have anybody fall out this time. And that's what One of the things Janet works on is for each of those vendors, we have to show that their employees are competent to provide whatever service they provide to us. And she's had a little bit of it's been a challenge to get some competencies from some of those vendors. So, at some point, we would have to determine, if we needed to move on to and research other vendors. Any questions about that?
All right, thank you. Next, Rita, share convalescent home report.
Hello. Gosh, March was kind of funny, and I'm not sure if I can remember exactly. I know we've gone through and looked at beds and tried to pinpoint the ones that were broken, and maintenance has taken care of those beds, and they are all now working, except a couple, I think. We've had admissions, thank goodness. We were down in March. We lost quite a few, either from deaths or they went home. We had quite a few skilled and they went home, which is what we want. That's what our skilled facility is about. I know the residents were busy, but I'm at a blank on March for some reason. But anyway, we have gone through the building and looked at different things such as painting. We have a family member or a staff member and her family that are going to donate some time to paint an area at the nurses station, which I think is great. Anytime you can get something like that, it makes it a part of them. Our census today actually is 52, so we rocked last week thanks to Harley and the hospital and St. Anthony's and St. Mary's. So we've gotten, I think we have some really good connections, and I talked to 3 inquiries today. One from Shattuck Nursing Home, that's a possibility, and 2 from Greenbrier at Enid, that is a man and wife possibility. So, the staff are working hard, and I can't tell you, it's hard sometimes getting that many residents all at once, and I'm sure we had plenty of mistakes. I know Dr. Kinsey had several. So
several mistakes?
Well, no.
Let's quantify patience.
No, we made mistakes.
Yeah, I knew.
There was, when you're talking about 3 or 4 admissions all at once over the phone, you just get things a little concocted. Anyway, it's been a busy April, and it looks like we'll end April good. We have more skilled again, and Kevin's working with us, trying to help us with staffing, and we'll try to get that better.
Well, Rita, keep doing what you're doing, because it wasn't just very long ago. I know you were beside yourself about the census.
Oh my goodness, it's scary.
She thought it was something she was doing wrong. It's like, no, it happens. So that's great.
I know, but when it gets below that 50 level, it is very scary. It's just very scary. So the good thing is, when they come in and they get well and they get better, we've had a lot of stroke that we've worked, and I have to say, Center Techs provides our OT and PT, and they work really, really hard to get them back to a level where they can return home, and we have been able to do that. There's still, those that come in and they're not going to get better, but at least we can improve them to where they can at least feel like they're taking care of themselves better. And of course, part of living is also dying, so we have had quite a few deaths in the facility. That makes it kind of hard. So, any questions?
Thank you, Rita, very much. Do we have anything from the homestead or?
Nothing special, other than what he's reported. I went through there, he didn't mention anything specifically. Kelly is on vacation this week, so that's why he's not here.
Okay. Very good. Next, Bridget, St. Anthony's report.
All right. We've been talking about our CIO agreement for quite some time in the room, and so we're proud to report that finally we have that in a working legal document. So Steve Powell and Dr. Rader will be returning to each facility to visit with each of the physicians and at whatever level to get people comfortable with the CIO, to see if you're interested in signing up for that. Just to refresh your memory, that's, you know, the ACOs are in the Medicare world and the CIOs are in the commercial side of things. And so that's what we have put together to try to work on the transition of care, the population management, and to layer on top of those contracts that there's the opportunity that when we do a good job with quality and cost containment, that there's an opportunity for additional dollars to flow into either physician practice or the hospital. And so we're excited about getting that rolled out. We actually had our first request for proposal from Health Choice, so we did submit that back into the state, and that covered about 10,000 lives. So we won't know for a bit whether we won that bid or not, but we think with our presence in Northwest Oklahoma that we certainly, for this part of Oklahoma, that we have a very good chance of winning that. So the hard work and effort behind that is certainly starting to pay off and come to fruition. So we hope many other provider contracts follow after that as well, so that we can all take advantage of the opportunity. The other thing is we finally kicked off our telehospitalist program, and we went live on March 18th in Cordell, and then we went live April 13th in Fairview. So far it has gone really, really well. Cordell only had one physician that was participating in inpatient care, so it was obviously very taxing to try to keep up with the clinic and the floor, and certainly helped in the emergency room at times too. So it has worked extremely well. He turned all of his patients over to the Mark V group, so they've had an average of 9 patients every day since then. So it's really been great, and it has worked exactly the way that we wanted it to work in that environment. At Fairview, they have physicians that still see their patients, and then they do have some that have turned their patients over to Mark V, so it's that nice blend. So we had shared with Candace that we would like to at least do 30 days in Fairview to work out any kinks or processes through that, and then we could discuss what a go-live date would be here at Shared Medical. But so far, everything's been well. Our 2 major concerns were how the community would react to it, and then, you know, how reliable with the equipment, with the infrastructure in rural America, how that would work for us, and everything has been just fine. The community has really embraced it. Most of the patients have been, our first patient was 92 years old, and really thought that it was just really wonderful. So, and each day has gone by, it's gotten easier and for them, and so we couldn't be more pleased with the program right now. So far so good. Like I said, we're still in that pilot phase. That was the intent, to pilot it at least for 90 days in each facility, and just kind of get the feel of it and see how each community does, because we know each of them will be different. So exciting things. Also, we have 13 beds that are going to open up April 27th. We certainly have had our fair share of capacity issues in Oklahoma City. We're not, unlike some of the other hospitals, have had the same issues. It's just been amazing kind of what's been going on. Everybody was busy during flu season, but it has continued on. We still have capacity issues. So we're glad that we have 13 more beds that are going to open. We continue to try to shift and remodel to get beds available and to be sure that we can support our affiliate network appropriately. So the other thing is we have Dr. Jane, who is joining our group. For our purposes in rural development, and we're excited to have him because we think it supplements the sleep lab program He does sleep disorders, so not just sleep with the CPAPs and whatnot, but if you have restless leg, anything that keeps you from sleeping well. Truly specializes in the area, doesn't do any family care, but wants to practice as a specialist.
And coming out to the facilities, correct?
He's gonna do outreach in Weatherford, but he's really, really interested in doing telemedicine.
Okay.
He's opening his services to whether, somebody has questions or uncomfortable with even knowing if they go to the sleep lab, or if they're fine sending them to the sleep lab, but they need follow-up after that, he'd follow them after that. Available for questions, just kind of whatever. He also wants to be involved in the rural network in different areas as well too. He's been willing to help us with some of our EPIC facilities for some enhancements, kind of quick steps to get around in the EPIC environment. So I think he's going to be a good member for our team. We've had him out trying to visit as many hospitals as he could while he's in the process
He's
of
actually
getting
called
his
me.
practice.
He called
Did
me
he?
probably
Oh, good.
2 months ago even.
Okay.
Yeah.
Yeah, he's had time in between where he was previously and starting this job, and he hasn't wasted any time in between. He's been out there calling the facilities and getting to know them, and we've taken him out as many times as we can. But like I said, we're excited because we really feel like it'll kind of supplement that sleep lab, because a lot of people go get the sleep labs done, get their CPAPs, but there's only like a 45% compliance rate on whether they stick with that program or not. And he has, about a 90% compliant rate with his patients, if monitoring and keeping up with them after that. So I think it's a good supplement. There's very few sleep disorder physicians in the state, and so we're glad to have him part of our team. So hopefully we'll get him out to Alva as soon as we can. So that's all I have, unless y'all have any questions.
Any questions for Bridget? All right, if not, Bridget, thank you again for being here and for St. Anthony's support.
You bet.
Bo, do you have anything to report from the city council?
I don't know how much, is usually talked about, but I can hit some highlights. Obviously, we welcome new members to the city council. Last night, we have three new members. And of course, our new member, Kelly Parker. Some highlights on the agenda. Basically, we did receive bids on the water meter project, which were all under what we had budgeted, which was good. We only received one bid on our street project for Flynn. We're going to probably take that back to the table, and plus hearing some feedback from the community, we might actually see if that's the spot that we actually need to do, or if there's some other areas that we feel like we need to approach first. Transfer station is on track, and you've probably seen they have started the stoplight project on 281, so hopefully that should be done by May, end of May, I think.
Cool.
And
Nice.
I think that was a pretty relatively short meeting, really, so.
You swore a lot of people in.
Yes.
Over and over.
Rick,
And over.
Rick was very busy.
All right. Well, Bo, thank you, and thank you again for joining us and being willing to serve. The next item, under the chairman's report, Scott was our secretary, and so we need to elect a new secretary. We will then have an election again here in a couple of months, because we'll do elections for next year, but we do need a secretary for the next couple of months. So Darlene is vice chairman, so she would not be able. So we can I would accept nominations for this position. How about that? You're more than welcome. Yes.
Haley's not making eye contact with anybody.
Yes, she did.
I was, I was making with him saying you.
Okay, I nominate Haley.
What does the secretary, what do my duties include, and if you get elected to that?
You have to.
Whatever Janet tells you to.
Yes, pretty much. Janet will take care of you, but you do have to sign off on, like, all the appointments that we did today. Those get signed off by the secretary, and then there's other documents that we approve through the board that have to have your autograph to make you famous.
Usually she sticks around after a board meeting and does some signing. Is that when a lot of it's done? So
Pretty much.
shouldn't require you to come up here a whole lot more.
If not, Janet will find you. We have a nomination.
I move the nominations be closed.
Can we just have a formal motion to?
Oh, yes,
Oh,
Terry.
To,
I make a formal motion to nominate Hala as our secretary. Is that good enough?
you're moving to appoint her, right?
Yes.
To that, okay.
I second that.
Okay. We have a motion by Terry Klein, a second by Darlene Sanderson to elect or appoint Hala Simon as the new secretary of the AHA board. Yeah.
We'll see.
Yeah.
That'd be fine to try out.
Roll call vote, please.
Klein,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Knox,
Yes.
Sanderson,
Yes.
Simon.
Yes.
Look at that, that was your fault. I have no other items of new business, and so we are adjourned.